Good afternoon, everyone. I would like to say thank you for our small group today. I think it's a good thing that we can record these meetings because then people who aren't able to make it can go back and watch. But I would just like to again say thank you for being here, taking the time to have this discussion about veteran health and healthcare. My name is Brooke Dickhart. I am the Executive Director of the Joel Fund, and our VMFA is the Greater Triangle Veterans Military and Families Alliance. What I'd like to do, I try to always start these meetings talking about our mission and our objectives. So people, if you're new, you have an idea of what we do. But this CVEB, we are VA connected, but we are community led and it's for our community partners. But our mission is to strengthen the local veteran and military community. And we do that by identifying gaps, opportunities, and barriers in service to improve service for veterans and military families. We coordinate information on services for veterans and military families, and we educate veterans, military families, and community advocates on community-based efforts and suicide prevention. So what I would like to start us off with is introductions. So as I said, I'm Brooke Dickhart, Executive Director of the Joel Fund, and we'll go around the room and then we'll have you ladies online introduce yourselves.
Okay. I'm Jennifer Melton. I'm with Veteran Services of the Carolinas.
Hey, good afternoon, Nick Drake. I'm the Director of Military and Veteran Services at NC State University.
Hey everyone, I'm Katie Braswell. I work with the Joel Fund.
I'm Daryl. I'm a whole health partner with Durham, VA.
I'm Andy Zinkovich, Veteran Community Engagement for Humana.
Awesome. Kristy, you want to go first?
Yes, hi everybody. Thanks for having us today. So my name is Kristy Andrews. I'm the Development Manager for HBOT for Heroes. And with me today, I have Elena Schertz. Do you want to poke your head in? She's over here. She's busy working. She is our nurse practitioner on our clinic side with Extivita. So she'll be here too for any questions.
Hi, everyone.
Hi.
I'm Elena. Like Kristy said, I'm the nurse practitioner here. I've been working here for about 4.5 years and can't wait to help out whatever capacity that may be. Thanks.
Thank you. Dr. Sabet.
Yes, hi everyone. Really excited to be here. My name is Raha Sabet. I am a psychologist. I'm also the whole health clinical director here at the Durham VA. I am stepping in today because our wonderful whole health coordinator, Ms. Kelly Prigge, is out sick. So I am jumping in for her today. So thanks for having me.
Thank you. I'm so excited to have this conversation. What I'd like to do is to start off for our panelists to have you, and I'll call on you, but just explain your role and within the organization. So, you know, if it's whole health, kind of just talk us through what your role looks like. And Kelly, you know, how you got into, I'm sorry, not Kelly, Kristy, how you got into this work, and just tell us your story as you introducing yourself. Furthermore,
sure. Do you want me to go first?
I do, yes.
Okay. I thought I heard you about it. Okay. Yes. So here at HBOT for Heroes, we provide our heroes here locally across the state with hyperbaric oxygen therapy. So we provide them with up to 40 treatments. Actually, I shouldn't say up to. They actually can get a little bit more than that if they need it. We do encourage them to do the entire 40 treatment protocol. That is what helps us establish our efficacy rate. We do have an efficacy rate of our last reporting of 98%, and that is of healing the brain of TBI and PTSD symptoms. So we receive funding a few different ways. We are a nonprofit, so we have corporate sponsors, donors, and we do receive some funding from the state of North Carolina as well. So I think you'd ask me like how I got involved in this. I started, I guess, as a patient myself, and I was running the marketing side of things for Extivita, and I saw what it did for myself. I was battling some pretty scary inflammation in 2019, and I've probably done about 40 dives, and that inflammation went away, and it has never come back yet. So it's pretty amazing, not only what it did for myself, but what it's doing for our veterans. They're seeing a very big difference in, of course, their inflammation markers. You know, they're sleeping again. So sleep is restored. Stem cells are activated. And for many of them too, their body is starting to like grow new blood vessels to their brain, because hyperbarics has the capability to do that if we have a part of our body that is damaged. So blood flow is starting to be increased. And then I was a treatment coordinator. So I was a treatment coordinator here for a little bit, and I really got to see firsthand what hyperbarics could do for our veterans, non-invasively, because it's just oxygen and pressure. That's the only thing it is. They sit in a pressurized chamber and they breathe 100% oxygen. So being able to see this and witness this, and some of our veterans getting off the pills, it was fascinating. So when we decided to start the nonprofit side, I was all in when they asked me if I wanted to kind of take the reins on that and build that. And we have treated about 80 patients so far over the past few years. And that is where we get that efficacy rate of 98%.
So thank you. Daryl, would you like to go next? Talk about your role within whole health?
Sure. I am the whole health coordinator of scopes, now the whole health partner with Durham VA. And what I do is I'm the pathway entry for. I go out and speak to vets and other groups and introduce them to whole health and what we do at whole health. And whole health is basically a different way of looking at health as a whole, and looking at the vet as a whole person, and not only treating for what is wrong with the vet, but what the vet wants out of his health, and what the vet can do to increase his own health. And what's really important, that's the most important part of it, is what's important to the vet about what they want out of their health care. And they teach a couple of different courses or small classes called one is Intro to Whole Health. And what we do is get the vet in, and whether we do it online with a few vets, which is the way we like to do it, is a forum of a few vets, but I'll do it one-on-one with a vet if needed. And we talk to them and explain the whole health and the entry to the whole health. And then we have another one called Taking Charge of Your Life, which is 6 classes. And those 6 classes, we go through the whole sphere of whole health. I don't have a form to show you right now. I have but we have a whole health wheel, and there's 8 different aspects of whole health, and we kind of run through that whole thing and introduce their veterans to each of those components so they can understand their healthcare better. And then, of course, once you've completed one of those, we can offer them a whole health coach. If they really think they need a coach to stay on track, we can get them attached with a whole health coach, and he'll help them set goals and kind of call them up and try to keep that vet on track, to try to keep the goals or reset goals, or kind of adjust. And really, my part is to get people in so that they can start enjoying life a little bit better.
Very cool. Dr. Sabet, will you explain your role within the whole health committee and group?
Absolutely. So my official title is Whole Health Clinical Director. I am a psychologist by trade. In this role, though, specifically, I'm really overseeing all aspects of our whole health programming. So if you think about whole health, you can think of 3 big areas as it aligns with like this cultural transformation, because that's what we're doing. We're transforming the way in which we make sense of healthcare. So we have the pathway part, which Daryl just spoke to. We also have whole health clinical care. So that's your typical conventional clinical care that you get from your providers at the VA, but through the whole health paradigm. And then we also have our well-being programming, which is focused on helping our veterans, supporting our veterans to develop the skills that they would like, that's aligned with living their life to the fullest. And that also includes working with our whole health coach and our whole health partner as well. So my role in particular, I'm focused a lot on the clinical care aspect as a clinical director, but I'm also overseeing those other components as well. And we'll be offering some mindfulness meditation courses through my clinical practice too.
Awesome. Thank you.
Sure.
I was telling Daryl, I was on the whole health steering committee for a number of years. I love how it takes this approach to look at every aspect of the veteran's life. Definitely something I wish had been around when my dad was going through everything. So better late than never, so I'm really glad it's there. But I would love for Elena to also share what her role is with the hyperbaric oxygen therapy.
Boy, I just jumped in there. I just heard my name spoken. I was like, that's my cue. Okay, I'm sorry. Who is speaking? This is Brooke.
Me, sorry, I'm kind
Hi,
of
Brooke.
looking in different directions.
Yeah.
Hi.
So you just asked what my role is in the clinic, correct? Yeah.
Yes.
So I'm the only provider here. So I'm a nurse practitioner, and I basically assess the patient. So I see them, I do consultations with them, do an assessment with them, and see if they qualify for hyperbaric therapy. And then we also do IV therapy here. So I assess for that too, if they're interested in it. And I have a medical director who I can contact. He's about 20 minutes away if needed, but I haven't had to do that in a while. So that's been a nice thing for us. But so yeah, I just oversee the clinic and make sure that everyone's feeling all right. Everything's going safely. We have other safety directors here too. So I'm mostly overseeing the clinical aspect of it. But of course, that just drips into the whole hyperbaric safety aspect as well.
Yeah, and for our veterans too, Elena, all of our veterans would meet with Elena before anything. So that is a first step with all of our veterans, is they meet with Elena to go over medical history.
Yeah. So every patient, like I said, I will do a consultation with them, whether they're veterans or civilians. And we will meet, well, speaking of just the veterans, we will meet at baseline and do a full consultation. And then we meet with them again at the 20-point mark, to assess and compare what's been going on from baseline to post 20. And then we'll meet with them again after 40 sessions and see how they did, if they reached their goals. And like Kristy said, we have 98% efficacy pretty much.
That's the last report. 98%.
Yeah, we have seen everybody improve all their numbers and severity and frequency and symptoms. We're talking PCS symptoms, PTSD symptoms, depression and anxiety symptoms. All shift to the left, which is a decrease in severity and frequency.
And I apologize if you already said this. Where are you located?
Yeah, so we're right near RDU Airport. So we're near the Briar Creek area down here in Raleigh, right off the TW Alexander.
Okay. And if you don't mind giving us a little more information about the treatments, like frequency, how long is one session, some of that basic information also.
Yeah, I'll answer that, Kristy. So for the most part, most of our veterans can dive twice a day. The only prohibitive aspect of that is really somebody with either COPD or seizure history. So I'm a little bit more cautious with them. And we prescribe 40 sessions. I prescribe 40 sessions, like Kristy said, and they're strongly encouraged to come consistently on a daily.
Yeah.
Like I said, some of them do twice a day. We really try to encourage them to finish this program within, was it 3 months?
Right at 3 months.
3 months period. Yeah. And so they will go into the dive, which is at 2.0 ATA, which is equivalent to 33 feet of seawater or 14 PSI pressure. And they are in there for total hatch to hatch, we call it, meaning the door closes and the door opens in about 85 minutes. So we compress, so we add pressure. That takes 10 minutes to reach the 33 or 2 ATA, 33 feet or 2 ATA. Then they're at bottom, we call it depth, for 65 minutes. And then we decompress at another 10-minute duration. And we have air breaks also in our protocol. A lot of the air breaks really will protect from oxygen toxicity. Even though we really don't need it at the protocol we're running, we like to add those for stem cell mobilization. It actually just increases that, or simulates stem cell mobilization as if they were leaving the dive. So there's been studies that show that if we change the breathing gases during a dive, the stem cells are activated to come out of the bone marrow and circulate in the system. There's some good studies about that. Does that answer your question?
Yes, thank you. Very interesting.
Mm-hmm.
Next, I would like to talk a little bit about how veterans access your services. So Daryl, I'm gonna have you start. Now, I know you're out in the community, you're meeting with veterans. Is it that they can just come to you and say, hey, I want to be a part of this? Is it best if they come from like their doctor from the VA? What are the different entryway points into the program?
Well, right now, we're reaching out to the clinics and they're learning how to give us referrals.
Mhm.
But not all the doctors at all our clinics know how to do referrals quite yet. But that's in the works right now. So coming in the beginning of the new year, it should be an easy transition if they ask their doctor, and their doctor will actually be talking to them about whole health. So someone will actually get from their doctors. Another way is, of course, I go out into just walking the hallways of the VA clinic and, I talk to vets and ask them if they want to hear about it. And if they're interested in listening, I'll give them the information and have them call. I have a couple of flyers that, of course, I'll pass them out and I'll email you a copy. It has our person's name, so you can actually schedule a meeting to schedule an appointment to have the whole health introduction. And of course, going out to some of the VFWs and passing out the stuff there, and they can get it from there. And also anywhere that you're at the VA, you can go online and go VA Whole Health, and we should have our website where it's easier to access us on now. But we've really kicking off really strong come January 1st. Everything should be online and it should be real easy to get in touch with anybody from Whole Health at the Durham VA. There are other whole health partners and within North Carolina with the other VAs. We personally work for the Durham healthcare system, which is here, you go straight across 70 to Pamlico Canyon. Did I say that? I don't want to mess up anybody's county. So that would be like New Bern, of course, Morehead City, Greenville. So all those up down the line, that those what we call CBOCs, which is the individual clinics. They're all part of the Durham healthcare system. And of course, the Durham VA being the flagship of our Durham healthcare system.
Awesome. And is it safe to assume they already have to be VA connected, or if we meet someone in the community, because we do a lot of work with veterans who are not VA connected?
No, they just have to be a veteran, and they can talk to me, and I can actually help them at least get their initial, and that's something they could do to the VSO either. I would say the easiest thing to do is go to VSO if you wanted to get, any type of disability rating, because we don't do that. But I can teach them how to get online and put themselves in the system. And also several of the different apps that we use. I can show them the apps that's offered for the VA for other symptoms that they might have that, just to use. But to answer your question, no, all you have to do is be a veteran, regardless of your status. We'll teach them the introduction. And also, if you're a family member or a caregiver, we'll also give them the introduction.
Awesome. That was gonna be my next question. Thank you. Very good. Okay, so Kristy, how do veterans get connected with you? Is this a free service? Do they have to qualify? I want to be able to share this information with our veterans and make sure, those are the kind of questions we'll get asked, right? Like, oh, does it cost? How do we pay for it? How do we qualify?
So we are a nonprofit at HBOT for Heroes. So we have two different sides here. We have the clinic side, which is Elena, and then we have the nonprofit side, which is myself. So at HBOT for Heroes, we do pay for all of our veterans to get 40 treatments for free. So the program that she's been talking about, with the 40 treatments to get that done within 3 months, it is completely free for our veteran. Everything is covered, including the consultation with Elena. So it's a package worth about $6,500 that we take care of. Like I said, there is some funding that happens from the state side too. There was $500,000 that was recently appropriated to us in the last budget. So every time we keep going back, they give us a little bit more, which is such a blessing. They gave us half of what we asked for. We asked for $1 million because we know we're going to blow through it. And hopefully next time we'll get a few million to be able to put that towards our veterans. So we are, of course, very much looking at, our corporate donors, sponsors, things like that, because we are also going to be increasing our clinic expansion. So we're going to be putting clinics across the state of North Carolina. They're going to be clinics just like this, which allows us to reach more veterans in their backyard. As far as access to how do people hear about us or how do they apply? They would go to our website, which is hbotforheroes.org, and that's the number 4. So hbot, the number 4, heroes.org. They go to apply. They put in just some very simple information, their name, phone number, email address. That goes to our treatment coordinators here at Extivita, and they reach out with the next steps, which is your application process, and then the portal registration, and then they get in to see Elena for the consultation, and it's through that consultation that Elena determines whether or not they qualify for the program. So myself and even our treatment coordinators, we ask very few questions to get them to that level, because we want to make sure she's making that medical decision on whether or not they're fit to go through the program. If they qualify on her end, then she does write the prescription for 40 treatments, and then they can start the program. So there's a few different ways that that they hear about us. I'm at a lot of events. So I think, Brooke, I know I showed up at the stand down. I think that's where we met the first time. So I try to get out there. I really try to be the boots on the ground. We're going to be at Childress tomorrow. So we're going to be at Childress Racing for their coffee event. So I've got about 5 minutes to speak there. We got a table. So we're kind of all over the place. People say that they see us out and about a lot these days. And so that's why we're getting a lot of people to come this way, and word of mouth is huge, because I'm telling you, once our veterans start healing and feeling better, they want to tell all their friends.
That's awesome. So this question, Kristy, I'll put to you first. As we're working with veterans, because so many of us in this room, that is what we do, and we're interacting with veterans every day. What should we look for in a veteran to say, hey, you should check this out? Should there be something specific that might come up in conversation that we should be looking for to make that recommendation?
Sure. So we look at two different things. So the state funding actually says that they're going to pay for the veterans of North Carolina to get this treatment who have had a TBI or PTSD. So those are the two qualifying factors. And they don't have to have been diagnosed with a TBI, but as Elena digs into their history, she's like, oh yeah, no, they definitely had a TBI. They maybe didn't realize it and maybe didn't report it, but that's definitely something we're looking at here. Then we look at that, to use that state funding. A lot of our veterans as well, they're going through other issues. Maybe they're dealing with chronic arthritis. They're in our older generation of Vietnam, but they're like, I never hit my head and I don't have PTSD. And in some ways that's okay. We definitely want them to still apply to the program, because we have other ways that we fund them. That's where we start using our corporate sponsors and donors to fund them through the program. So I really would be looking for those people who are really struggling from the PTSD and the TBI symptoms, as that is where our main funding is coming from right now from the state. And those are the numbers that we're giving back to the state, where we say, hey, we've treated these many veterans. They had, traumatic brain injuries, they had PTSD, and this has been our efficacy rate for treating those veterans.
Great. And for whole health, is there anything, because we can talk about that with every veteran. So there's not necessarily something we need to look for. I talk about it to all of them anyway, because you got to hear about whole health. So I don't even know if there's really an answer for you to give me differently than that, right?
Yeah, no, you got it right, Brooke. It's really about every veteran, every encounter. We really want to reach all veterans regardless of discharge status. So you got it. And thank you for the advocacy that you're doing to promote whole health. Really appreciate that.
Absolutely. I think it's great. When you mentioned the family members and the caregivers, Do they get access within the system with that, or can they just get trained so they have an idea of how to provide guidance to their veteran?
There are certain things that some family members have. The caregivers we have a whole program for caregivers. And I can share their contact with you also later on. But we have a whole caregiver program at the VA that offers a ton of support for caregivers.
We do a lot of work with them.
Yeah.
They're wonderful. In fact, we just, I guess last week, 2 weeks ago, had an event here.
Yeah.
And Isabella, our Operation Art Program Coordinator, does an art project with them, and then they come in and they did some stage training. And so, yeah, love that group.
Yes.
That's awesome. Okay, good. So, I always like to end with this question because of what the VMFA is all about. What gaps or struggles can you identify that we can work together to minimize? Whether it's getting the word out or, making sure that it's clearly that we articulate, what it is your mission is and what what your objectives are. What can we do? Any gaps or struggles? Kristy, you want to start?
Sure. I think our biggest thing that we run into is the fact that most people don't know what hyperbaric oxygen therapy is. And it has been around for over 100 years. This is not a new therapy. This is something that we know works. We're actually working to that when you put a person under pressure and then you give them the oxygen, it drives that oxygen right into their blood plasma. And so, our bodies know exactly what to do with it. They know how to heal. And so if any type of education on the hyperbarics, letting our veterans know that there is a very non-invasive option that is available to them. They do not have to always turn to pills. And sometimes, then they're turning to more pills to combat the side effects of those pills. It's just this vicious cycle. Our mission here is tenfold, and that is to stop suicide. And we do know that it works. So as we move down this road of more clinics and more veterans, we definitely send the veterans our way, encourage them to apply. And really, we don't discourage anybody from not doing it, because honestly, if they're a veteran and they're dealing with any health situation, they should do this, and we will take care of that cost. So I need the veterans to come, because the next time we go back to the state, I need to be able to show that we have a wait list. I need to be able to show that, hey, we asked you for $1 million and you should have gave it to us, because now I've got hundreds of them that want to do this. And we really do. We actually have 280 veterans right now in our treatment queue. And so they're floating all around in there. Some of them are in the program. Some of them are waiting. Some of them we're waiting on them to give us their DD-214. But that is the big thing. That's really the one thing that they have to have, is they have to be a North Carolina veteran, and they have to have a DD-214 that shows honorable discharge from the military. So those are the two big things that they need to send our way.
Okay. One quick question before I ask Dr. Sabet to answer that same thing. You said that, do they ever have to come back for treatment again? So they do their 40, there's improvements. Is there, should they be coming back every so often to make sure that they stay at that level of improvement?
So they absolutely can. We have some that come back and we call it a bit of a tune-up, and we'll give them 20 more dives. But for the most part, this is a permanent solution. It's a permanent fix. If they maintain a healthy lifestyle, they continue to do it. We have toxins. We have environmental aspects in our lives. We don't eat healthy sometimes. We don't exercise. So Elena especially, she highly encourages them after they finish the 40 that this can be a permanent solution for you. Change your life. You went through this entire program. You dedicated all this time to do it. Don't go backwards. So we've healed your brain. Continue to move forward. We do have some that, especially if we were dealing with any type of substance abuse, there's definitely an opportunity there that we're really pushing them in that direction, not to fall back into some old habits. We've healed that chronic pain. We're doing much better. So yeah, I think it's just a whole matter of pushing the veteran to live a healthy lifestyle. But if they need it, they absolutely can come back. And for some of our veterans, 40 is not enough. Well, some of them have there's a lot of damage. And so if they need to keep going, that's okay. That's okay. We'll keep pushing them through. We're still going to test them at 40 so we can get our efficacy rate, but we don't turn anybody away. We don't say, oh, sorry, you've already finished your 40. No, if it's helping you, then we can keep going if we need to.
Thank you. Dr. Sabet, what are some gaps or struggles that our community, the community partners can help, with whole health?
Yeah, absolutely. I really love this question, and credit goes to Kelly who shared this, and I totally agree with her. So space is a little bit of a barrier for us, and we absolutely want to be able to meet our veterans where they're at. Obviously virtual is an option for some of the program offerings that we have, but getting space in the community would be really, really wonderful and more convenient for our veterans. So yeah, I would say that's a big one.
Perfect. So then we need to talk about that, because we, that's what we do. We have this room. If it's a few veterans, we can fit up to 10, we can do that here. And like I said, we've been doing it with the caregiver team. So please consider that as you guys are moving forward in this spring and stuff with setting up classes and that sort of thing. We'd love to host that.
We have Humana neighborhood centers across the state as well.
Yeah.
Raleigh, Winston-Salem, Greensboro, and Matthews that have pretty much every room can, I think, do 40 safely, and they are technology capable as well.
Awesome. This is great. So yeah, Daryl, we will have to follow up on that for sure. Thank you all so much.
I won't let him leave without giving her a call.
And another question, just because when I was part of the steering committee for whole health, we talked, there was a period of time where and I apologize for this, I was supposed to be working on a list of community partners. And then there was a lot of change. They were hiring the employee. A lot of focus became on writing that job description and that sort of thing for someone to lead it. So, and then I became busy. So I guess what I'm saying is I never got it done. But I still hope that that's something that Whole Health is going to do, is have that list of community partners, because even just with the Joel Fund and with, Kristy and the work that they're doing, I think those are just two great resources that should be a part of that list for Whole Health, partners in the community.
It definitely is, because it's also, like, for instance, the hyperbolic, I forgot what they call it.
Hyperbaric, yeah, I have to look.
HVAC for heroes, that is something that if we had a veteran that we're talking to at our Whole Health stuff and say, you know what, have you tried this place?
Mm-hmm.
This is something that another agency offers. So yes, we definitely find other community around that's doing things that are healthy for our vets, and we do offer it. Well, we don't offer it, but we let them know about it, and we tell them how to get in touch with those different places. And so yes, definitely. We are trying to connect with other agencies, and that's why I come to the coffees all the time and see the great things that the Joel Fund is doing, and the other ones around that we see. And I was on there when we was talking about everything to do at NC State. I want to make sure that we could share some of the stuff we do over there.
Yeah, that's why we do this, to make those connections and to. I don't know, Dr. Sabet, if you have patients where you can make those referrals or mention, I know with Kelly, she told me, it all has to be free, right? Free services in the community. So I think something like that it's important then to share and let our veterans know what's out there all over the place.
Totally. Absolutely.
All the options. So, well, good. This meeting's a little shorter, I think, because we don't have as many people, but do you want to add, please?
Oh, well, I just wanted to, Kathy, is it Kathy?
Kristy.
Kristy. Yeah, so you're talking about, after they go through all that stuff and how you want to keep your vets healthy and doing healthy things. So you should, get one of these flyers.
Yes.
And let them know, hey, how about you, reach out and you can learn ways of keeping yourself healthy. Because, honestly, if healthcare across America, you're talking about 75% of our healthcare costs is because we're sick. Yeah. And if we can take care of ourselves, then we can lower our own healthcare rates that we pay, out of pocket, whether it be for your co-pays and everything else. If you're taking care of yourself and you don't have to go to the doctor as much, your primary care visits are almost covered for free. Is when you're sick and have to pay all these extra money, is where most of our healthcare money is going. And whether no matter who you are, you can benefit from that. Whether you get your health care from the VA or you get your health care from the system, you can definitely benefit from at least coming to into the whole health, because it's a concept. It doesn't, even though the VA offers it, it's a concept. So a vet can, whether they get our health care from us or not, can definitely benefit from our programs.
100%. And one thing too that I would like to mention to everybody as well is please come take a tour of our facility. I'll give you a tour. I do tours a few times a week, it seems like these days. I'll take you through. You get to see exactly what we're doing, the behind the scenes, the chamber. This is when things get really interesting around here, and the very impactful work that we're doing. So it's a very exciting tour. Most people say it's the best field trip they've been on in a while. So do kind of keep that in mind. And then I would love to be able to, talk to you face to face about that and give it, you give me some more information that we can always pass on to our veterans. We are working on a resource guide. So they're here. We have some veterans that come, they stay for 4 weeks in the area because they're not from this part of North Carolina. So they stay for 4 weeks here. So we're always trying to give them, more resources of things that they can do, different ways that they can take the impactful work that we're doing here and bring that back to their area of the state. And of course, ways that they can stay healthy once they finish their treatments.
Anything else or any other questions from the group? No. How about announcements? I always like to end with announcements. Sure, we'll talk about ART.
Oh, sure. I'll talk about ART. So, the Joel Fund runs Operation ART. We provide low cost or free, depending on if you need scholarship, classes for veterans, family members, any military connected individual. So spring session 1 is starting in January. Our class offerings are now open. Our virtual writing classes fill up quickly. So if that's if you have a veteran in your life or you're interested in that, sign up now, because they'll be full by next week. We also are offering, I think, wood carving. They're going to be carving spoons and things like that, which is super cool. We also are offering textile collage, which is a women's only class. Something that we started offering this year. And we are also doing several workshops, family studio Sundays, so that's for families to come. So it is on our website. Brooke will put that in the follow-up email. Yeah. Oh, and if you guys are free tomorrow morning, the Joel Fund is doing their coffee a week early because of the holiday season. So tomorrow online at 8:30 or in person at 8 if you want coffee and donuts.
Chick-fil-A.
And Chick-fil-A. My apologies.
Too.
That's important. I feel like that is the sell right there.
Yeah. I brag with food.
Yeah.
Any other announcements? No, I'll make sure, Daryl, if you can also send me a digital copy of that.
I definitely will.
And then, we can put those flyers, we have space on our resource shelf. And then, Kristy, if you have anything that you want me to send out, in our follow-up email, please email that over to me and I'll send it out in the next day or two.
Yeah, absolutely. And if you have a resource shelf there too, maybe I need to make a trip to you or come to the clinic so I can fill you up with all sorts of good stuff that you can make sure that our veterans know about this free 40 dials that they can get here.
Perfect. Fantastic. Anything else? Okay. Well, happy holidays, everyone.
Thank you all.
Thank
Thank
you.
you. So nice to see you. Happy holidays. Take good care. Bye.